Spanish and Spanish to English. Please select your language in interpretation. Queremos dar las gracias a cada uno de ustedes por
We want to thank each and all of you for joining us in this webinar. We're going to try to share lessons learned and strengthening our response to the elimination of mother-to-child transmission using the SIP, the perinatal information system. So the aim here is to give you an outline and an update of SIP and to promote SIP as a surveillance tool and to enable countries to use their own data to draft reports and to make the most of SIP Plus coordinating activities at the national level. So with this, we open the webinar. We invite Dr. Susan Cerrulla, the director of the Latin American Center for Perinatology, who will welcome us. Susana, you have the floor. Thank you, Rodolfo. Thank you, and welcome you all. This is a very special meeting for us. Many years ago, when I just entered CLAP, the first one click we did was syphilis. For a very simple reason, because we believe at CLAP that we can succeed in eliminating syphilis radically, the vertical transmission. Some countries have already done it and others are about to. So we have an ongoing work with people like Sandra Jones, whom you all know, and as well as leaders of the countries that are going to present the situation today. And from SIP, Giselle Tomaso and Luis Mainero are going to show you not just how we can do the certification process, but also in our daily work to maintain certification and guarantee that we can eliminate syphilis. And more than that, getting to know the indicators and where we are not doing well. The perinatal information system is more than a tool. It is an opportunity we have to get to know the reality of each mother and her baby very closely so that we can have better health outputs. I have a bit of noise outside because I'm in Geneva. I'm at another meeting, so my apologies. But I wanted to take advantage of the situation because I won't be able to be there at the end of this meeting for all of you who have worked so hard. First of all, I wanted to thank Sandra Jones because, as I just said, from the Caribbean, she brings the discussion on how we can follow the example of the Caribbean, because they have 7 countries that have already succeeded in eliminating the mother-to-child transmission, and to take it to other countries. I see that we have Natalia, a dear old friend, Dr. Mansour, and I also see others. Well, I was just greeted by Trinidad and Tobago, Dr. Addis there. So this is a time for you, the countries who are joining us today will be able to debate this. And I want to thank the CLAP team, and especially Rodolfo Gomez, who is the advisor of sexual and reproductive life and health, and Giselle Tomaso of SIP, and Mariana and Luis. I see the translators, Arta and Ines, and of course, Melina, who has transmitted the entire stream. She's been in charge of streaming. We are close to the Christmas holidays and the end of the year. So let me wish you Merry Christmas and a Happy New Year, and may we have health and social justice next year. Thank you all. I'm sure that you'll have an excellent seminar. Thank you. Bye-bye. Thank you, Suzanne. Now, we're going to give the floor to Dr. Sandra Jones, who will talk about strengthening surveillance of maternal and child left to support the ratification and rectification of so that we can eliminate vertical transmission. Sandra, the floor is yours.
You are in mute, Sandra. You are still in mute.
Okay, my apology. My apology. Can you see my screen appropriately?
Yes, yes, everything is perfect.
Perfect. Good
Go on.
morning, and thanks to everyone for joining this webinar today. I am pleased to see some of the colleagues from the member states in the Caribbean, and we're happy for you to actually join us. Please allow me to very quickly go through the essential reasons for the strengthening surveillance for EMTCT, which is one of the essential functions for the validation of EMTCT of HIV, syphilis, and hepatitis B in the Caribbean, known as EMTCT, EMTCT plus. My slide changed?
Not yet.
Right. So as I mentioned earlier, surveillance is a functional requirement for the validation and the revalidation of EMTCT in the Caribbean. Data quality for EMTCT plus validation is assessed for completion, for accuracy, consistency, and timeliness. And so I'm sure that you will agree with me that it is important for us to have an adequate surveillance system that can produce the information. It is important because you have, as a country going up for validation and as a country in the process for revalidation, need to demonstrate that you capture and can monitor cases, the entire continuum of care that is provided to the pregnant woman and the exposed infants, demonstrate through the programmatic indicators as well as the impact indicator, the achievement of those targets. And for that, what is critical is the numerator and the denominators that you can use to calculate those targets, as well as the follow-up. How well are you providing follow-up services to the exposed infants? And of course, to capture the incidence among women of reproductive age and the family planning services that is offered. Most often, people would think that it's only for the capturing of data from the public, but no, it also includes the data from the private antenatal care, because we must remember that EMTCT is national. And because it's not national, it's very important that there's some mechanisms that is in place to actually capture the data from the private. That may be at the hospital, but it's up to the country to determine how best that information is actually captured. So for most countries, that because an adequate surveillance is not in place, for most countries, what we have noted is that retrospective data collection has been the norm. Yeah, it is good for the first for submitting the first report, because at the time it provides you with the opportunity to cross-check and triangulate the data to say we have checked and there we do not have any other cases than from what we are reporting. But when going forward for revalidation, there should be in place an adequate system that will allow for the critical monitoring and support the whole maintenance of the certification, so that if a case is identified, it is identified very early and the interventions will be implemented, and it's not going to be at the end of the 4 years when the report is being put together, you realize that there was a case. And of course, at that time, it is too late. And what I'm saying here, these are based on examples that we have seen. Another important thing to include when we're looking at the strengthening of surveillance for EMTCT is to ensure that there is accurate case definition as is established for the EMTCT validation. It's not a clinical definition, but it's a surveillance, surveillance case definition that is based on the timing of when a woman is treated and treated appropriately with penicillin, no other medication, and as well looking at the treatment and the intervention to the exposed infants. I just want to take a pause here to say that when we're looking at surveillance for EMTCT for congenital syphilis and other areas, it is also important to strengthen the surveillance in the general population, not only in maternal and child health, because for syphilis, we are seeing an increase in syphilis. And these must be monitored in order to ensure that timely interventions are in place for the general population, because when you see at the antenatal level, by the time it is too late, because it is widespread in the general population. So it's good to also have the surveillance in place to monitor the general population. I just want to actually mention here that PAHO has put in place a number of mechanisms to actually support the EMTCT in the Caribbean and the strengthening of such. We are putting in place a dashboard which we will be shared, and these will be able to be accessed by countries. But also I want to take the opportunity here that when we're talking about surveillance, and for EMTCTs, not only HIV, syphilis, and hepatitis B, but we have HTLV, which is soon to come on stream. And so it is good that when we're strengthening the surveillance, we're strengthening surveillance for all these conditions. I just want to very quickly, because I know I have a very limited time, to look at some of the priorities, and well, I would say 2 major priorities in the Caribbean to actually strengthen surveillance for EMTCT. We have a regional project which which all of the countries, the CARICOM member states, have endorsed, and this project is going to come on stream next year. It looks at the whole strengthening of the leadership of the EMTCT within maternal and child health. And within that framework, one of the major components is to actually strengthen the surveillance, because we realize that this is actually critical, because we're talking about validation, but it's also the quality of service that is provided to women and children. And of course, we know CLAP has been working with countries to actually strengthen the SIP perinatal system, which we realize is a very value-added tool to support the EMTCT in the Caribbean. I know some countries have the paper-based, and some countries are moving towards the electronic, and that is very good. I want to also highlight that the EMTCT Plus, for those who may not know, is within the wider framework of the elimination agenda of communicable diseases and other conditions. And as we move to eliminate diseases, there is a need to have a very strong surveillance system to demonstrate that we have indeed, as countries, eliminate those targets. Just before I end, I would just want to asked Dr. Bear, the maternal and child health coordinator from Belize, if she could just, in a very quick summary, outline the importance of having an adequate surveillance system for SIP, because this country was just recently validated, and I think she would have some value information to share. Dr. Bear, I turned over to you.
Natalia, tienes tu micrófono en mute. Natalia, no te escuchamos. Natalia, doctora Natalia Largaespina, por favor, si puede poner su micrófono abierto y escuchamos sus comentarios. Adelante. ¿Tiene alguna dificultad la doctora? Vamos a dejar abierto para el momento en que pueda resolver este inconveniente, para que pueda hacernos su comentario final. Natalia, cuando tengas tu micrófono resuelto, por favor nos avisas y te concedemos el tiempo para que puedas compartir. Mientras eso sucede, vamos a darle espacio a... estás volviendo a entrar, Natalia. Nosotros no podemos desmutear tu micrófono, deberías hacerlo tú. Ok.
Rodolfo, simplemente una aclaración. Natalia me dice que está con un problema, va a salir y volver a entrar.
Perfecto, muchas gracias. Entonces vamos a darle el micrófono, vamos a darle la palabra a
Let's
nuestro querido
hand the
compañero
floor
Luis Mainero,
to our dear
que
friend
va a
Luis
contarnos
Mainero, who will tell us
rápidamente sobre
briefly
el
about
sistema de información perinatal Plus,
the
que es una
plus
herramienta versátil,
perinatal
innovadora
system
para el
plus
seguimiento no
an
solo de la
innovative
sífilis
tool for
congénita
follow-up not
HIV y
only of
hepatitis B, sino que
congenital
también
syphilis,
para otras cosas. Ahí estás,
HIV,
Natalia.
and
Bueno, antes de
hepatitis
darle
B, but
paso
for
a
other
Luis,
things.
por favor,
Natalia, you're
escuchamos.
there.
Adelante,
Before
Luis.
hearing
Muchas
Luis,
gracias
we'll hear
por
you.
estar.
Thank you
Adelante.
for being here.
Dr. Rodolfo, thanks, Sandra, and thanks, Dr. Cerrulla. The surveillance system is key for both certification and recertification of eliminating mother-to-child transmission of HIV and syphilis. We do have an electronic medical record system in place. We collect data from public and private. We have a master list of pregnant women with positive HIV, syphilis, or hepatitis B. The follow-up is done on a daily, maximum weekly basis, monitoring that women have access to treatment and adhere to treatment. We use an Excel sheet for the line listing with all the necessary variables, and then we use Google Calendar to send plan dates for tests that correspond to the HIV-exposed infants or syphilis-exposed infants. We use email and WhatsApp to send reminders. The local level do their follow-up, but the central level also oversee the work that is being done at local level. The data is collected from the clinics when providing antenatal care in both public and private sector, and from the Central Medical Laboratory in Belize, where confirmatory test is done. We also have a network of HIV counselors that also provides data. to improve the surveillance of the programmatic indicators, the National Validation Committee recommended that these should be also documented in the delivery logbook. So this was updated to integrate the data to access prenatal care and screening and treatment. So this is one non-negotiable criteria for achieving certification and recertification. So all efforts in strengthening your surveillance system is a must. Over.
Natalia, muchísimas gracias. Y aquí podemos ver un caso de
Thank you so
éxito.
much, Natalia.
El
Here
sistema
we
que
see
tienen
a
en el
success
país
case.
ha
The
permitido la
system you have in your country
certificación
has
de la
enabled
operación y este
certification
fin
of
de felicidad
elimination,
a la doctora
and
Jones.
as
Es uno
Dr.
de los
Jones
últimos
said,
países que ha
it's one of the
recibido
last countries in
esta
receiving
certificación del
this
Comité Regional.
certification
Por lo
from the
tanto,
regional committee.
felicitaciones
So
nuevamente al
our
país
compliments
y el
to the country.
ahora sí vamos a
And
permitir
now we're going to allow
programador, el ingeniero Mainero, que
Engineer
nos
Mainero,
exponga
the
algunas de
programmer,
las
who will
innovaciones
share
que tiene el
some
SIP
of the
y por qué es
innovations in
útil
SIP
para
and why it's useful
monitorear
not
la
only to
implementación y
monitor
la eliminación, sino también
implementation and
algunas otras cosas.
elimination,
Luis,
but some other
adelante,
things.
por
Luis, the
favor,
floor is yours.
abre tu micrófono.
Please open your mic.
The floor is yours.
The floor is yours. Okay.
Se ve ahí la pantalla en modo
Can you hear
presentación.
my screen in the presentation mode? Yes, perfect. Good.
Bueno, buenos días a
Good
todos y
morning,
todas. La verdad que
everybody.
estaba mirando un poco en el
It's
chat
truly
los colegas que se han conectado. Es una alegría
a,
ver
a
algunos
joy
colegas de
to
los países que
see
hacía
the
tiempo que no
colleagues from the
veía.
different countries I haven't
Y
seen for
les voy a
some
contar
time.
un
I've been
poco,
looking
como
at the
solemos
names
hacer
in
en
the
estas
chat.
presentaciones,
And as we usually
las
do in
novedades
these
que hay
presentations, I'll
en
tell
el
you about
software.
the novelties in our
Muchos
software.
de ustedes lo conocen, más
Many
para
of
los más
you are
gatos
familiar
habitués,
with
para los que
it.
son
This
nuevos,
is
que es
rather
el
for
SIP en
the
esta versión SIP
newcomers.
Plus.
What
Bueno, el
is
SIP es
the
un
SIP
estándar
Plus
clínico de urgencia
version?
para la
SIP
atención a
is
las
a
mujeres de recién
powerful
nacidos.
clinical standard
Y
for
ahí hay
caring
una
for
breve
women and
descripción, un
newborns.
poco
And here we
también
have a
para,
short
aprovechando que va a quedar grabada
description.
la presentación para que
And
puedan
because the
revisar
presentation will be
luego si
recorded, you
tienen
can look
tiempo,
through
si
it
tienen
once
interés.
again if you have
Vamos a
time
ir
and
un poco
interest.
rápido, hay muchas
Will
cosas para
be
mostrarles nuevas,
fast. There are many new
pero
things to
bueno, en
share,
líneas generales
but in general
trata el
terms,
software de
the
representar
software
las
tries to
líneas hacia las áreas
represent
clave como son
the
salud de la mujer,
CLAP
salud
areas of
reproductiva
work,
y salud
women's health,
neonatal.
reproductive health, and neonatal health.
Esta breve conclusión, como quien
This
dice, que
short
suelo ponerla al final,
conclusion,
pero
it should have
nuestra
been
idea
at
cuando
the
hacemos
end,
las
but we
presentaciones para poner al
changed it
principio,
in the
un poco para que
newer
ustedes se enfoquen un
presentations at
poco
the
en qué
beginning.
es el SIP
So
y qué
you
tiene el
focus
SIP.
on what
El
SIP
SIP
is and
mejora la
what it
gestión, la
includes. It improves
efectividad, la
management,
eficacia,
effectiveness,
tiene todo un módulo de
specificity.
análisis,
It has
pero
an
en cuestión amarillo
analytical
cosas que
module,
creemos que
but
son bien
in yellow,
importantes.
we
Una
have
es
the most
que en
important things.
esta
One,
versión
in this
SIP Plus
version,
se
SIP
reducen
Plus,
los tiempos porque el
the
software se puede
times
instalar en
are
tiempo
shorter
real para que la
because it can
información
be
pueda ser
installed
evaluada en
only
tiempo
in real
real.
time to assess information in real time
Mejora
alone.
la calidad
It
de
improves the
atención,
quality of
garantiza la
care. It
equidad. Esto
guarantees
es algo que se ha ido
equity.
incorporando en las
This
últimas
has been
presentaciones
included in the
porque
more
el hecho
recent
de que el
presentations
software
because
tenga
having the
una
software
información estandarizada para
including
atender a
standardized
cada una de las
information to care
mujeres
for each of the
permite
women
que aseguremos
allows
que a
us to
todas las
make
mujeres
sure
se las
that
atienda
all
igual
women are cared
y
similarly.
finalmente que es
And in
gratuito. El
the end, that
software
is free
es
of
gratuito, el
charge. The
mantenimiento es
software is free
gratuito,
of
las
charge. The
modificaciones las
maintenance,
hacemos
likewise.
desde
We
el
do the
equipo SIP con los colegas
modifications in the SIP
que fueron
team together with
presentados
the colleagues already
y
introduced.
esto va a continuar siendo
And
así.
this will continue
¿Cómo
being
funciona el
so.
software? Bueno, como
How
ustedes
does the
saben, el software se
software
va
work? As you're
cargando la
aware,
información
we
en las
provide the
diferentes
information
instituciones,
in the different
con la
institutions,
diferencia de
but
que
the
en
difference
esta
is that
versión
in this
el
version,
software puede enviar
the
la
software
información
may
a un servidor
send the
centralizado,
information
ya sea de la
to a
institución
centralized
o
part, be
como
it the
algunos
institution
países han
or
hecho,
as
que es que
has
lo
occurred in
envían
some countries, they
directamente, por
send it
ejemplo, en el caso de
directly,
Argentina,
for
a un
example, in
servidor
the case of
provincial.
Argentina, to a
Esto es un
provincial
poco
server.
atendiendo las
This
necesidades
is
de los países,
responding
porque
to
no
the country
todos
needs
los
because
países funcionan de la misma
not all
forma,
countries work
pero
in
¿cuál
the
es la
same manner.
finalidad
But what is the
última
aim,
de
the
esto?
ultimate aim
Poderlo
here?
enviar al
To be able to
Ministerio de Salud
send it to
Pública
the
en
Ministry
un
of Public Health
consolidado nacional
in a
para poder
national
vincular la información
consolidate to
con el
relate
certificado
the
de nacimiento
information with the live birth certificates, with death
tiene que ver con
certificates,
curso de
with
vida,
civil
con
identification,
con
life
vacunas,
course,
dolencias o antibióticos.
communicable diseases,
Muchas de las
vaccines,
cosas que
violence,
nos reúnen
contraception,
hoy
many of the things that gather us today
en esta reunión.
in this
Entonces,
meeting. So,
un segundo. Entonces, ¿qué tenemos de nuevo para mostrarles
what
o
do we
para
have
compartir?
to
Bueno,
share
estamos
with you
lanzando un
again?
aplicativo
Well, we're
MISIP
launching
que
a
permite
MySIP,
justamente
MySIP
recuperar la información que
application to
pueda ser
recover
enviada a las
information and
mujeres
send it
mediante
to
un
women
aplicativo móvil que tiene
with a
instalado
mobile app
que podría tener
installed,
instalado
or they
en
could
sus
have
celulares.
installed in their
Voy
mobile
a pasar un
phones.
poco de alto esta parte, le voy a contar los
I'm
módulos,
now
me están
going to
apurando por el tema
skip
del
this.
tiempo.
We don't have that much
Le voy a
time,
contar
so
un
I'll
poco
tell
los
you about
módulos
the
nuevos que
modules,
hay
the
con el
new
software, como
modules
pueden ir en la
in
historia
our
clínica
software.
prenatal, con el
The
formulario NIARMED que todos ustedes
prenatal
conocen,
clinical
tienen la
record
neonatal, la de
with the
aborto,
form
la
you're aware
parto-congénita,
of,
que algunos
the
países ya se
neonatal
pueden anotar en
abortion,
diferentes etapas de
congenital
avance
abnormalities.
sobre estos temas,
The
perdón.
different
Pero
countries
también hay
are
algunas cosas nuevas
levels
como
in this
son
regard because we have other new
anticoncepción,
things,
violencia
contraception,
para
violence,
adolescentes, salud
adolescence,
mental, seguimiento
mental health,
neonatal y hay una
neonatal
cantidad
follow-up, and
adicional de historias
an
clínicas
additional number of
que están
clinical
disponibles
records
para ser
available
utilizadas.
to be used.
Las ventanitas que aparecen ahí, las
The
ventanas que
window
aparecen
you
ahí
have
con las
there,
banderitas,
the
son
windows
los
with
países que nos han
flags
pedido algunas
correspond to the
modificaciones
countries that have
específicas para
requested
la historia
specific
clínica perinatal.
modifications for the
Entonces, los que no
perinatal
aparecen
clinical
ahí usan
record.
la
So the
regional
ones that don't have it
y
there
han
use the
pedido
regional one,
algunas
but the ones
modificaciones
that do have
específicas
requested
para estos
specific
módulos.
modifications for these modules.
El otro módulo importante que tiene el software es la parte de análisis y de reportes automáticos, entre los que destacamos el EDMI Plus, que es el que va a
The other
mostrar
part is the
Tomaso en breve.
automatic
¿Sí?
analysis
Hay otros
that
módulos, hay otros
the
reportes automáticos, y lo mismo que ocurrió
EMTCT
con las
that
historias
Giselle
clínicas,
Tomaso is going to
ocurrió
present. And the
también
same thing that
con los
happened with the
reportes de
medical records
admisión.
happened
Hay
also with
algunos
the
países que
care
nos pidieron
reports.
desde los
There are some
Ministerios de Salud
countries that
Pública
requested
la
from the ministries
modificación de
of
estos
health
reportes
to
para
alter
poder
these
enviar
reports
los
so
reportes de forma
as
automática a
to
cada una
make
de
it
las
possible
instituciones
to
y que el Ministerio de
send
Salud
them
Pública pueda
automatically to
controlar a
each
cada una con el mismo
center, and
modelo
so that the
de
Ministry of
reportes.
Health could
Ahí hay
control
algunos reportes que
all of
pidieron
them
estos
with the
cambios,
same report
los
model.
tenemos
There were
identificados,
some
pensamos
that
venir un poco
requested
también
these
para
changes. We
reconocerles el
have
trabajo que han
identified them with
realizado
the flag
durante tanto
to
tiempo.
recognize
¿Qué
their
tiene el
long
software
work.
dentro?
So
Y
what
bueno,
does the
tiene más de
software
30 historias clínicas
have?
con
Well, it
por más de
has over
3.200
30
variables, tiene
medical
más de 30
records,
dashboards
over
automáticos, tiene
3,200
aproximadamente
variables,
2.000 indicadores de salud,
approximately
que ese
30
número de
automatic
palabras que aparece
dashboards,
ahí, que está en español,
2,500
aparece justamente
automatic
representadas
indicators.
las
In
áreas
that
de trabajo
cloud,
de
you
clave, como
have
decía, la
the
salud de la
areas
mujer,
of work,
salud de recién nacido y salud
women's
materna.
health, newborn
Tiene
health, and
recursos,
maternal
guías,
health.
manuales,
It has
capacitaciones,
resources,
cursos en
guidelines,
línea que están
manuals,
disponibles en la página web
guidelines,
y eventualmente
trainings,
pueden
online courses that are
hacérselo si
available
lo
on the
creen
website.
necesario
And
para casi
if you
las
wish,
200 o 200 colegas
for
que hay
the almost
que hay
200 colleagues
conectados en
that
este
we
mundo.
have
El
connected
software nuestro no
today,
está
that's
pensado
available
para
for
hacer
you. Our software was not
trabajo de
designed
investigación.
for
Está pensado para la
conducting
atención, está
research,
pensado
but
para que
rather
los
for
reportes se
care.
puedan realizar
It is
en las
so
instituciones de
that
salud y
the
en los
reports
ministerios.
can be
Pero
developed at the very centers
esa
and at the
información
ministries. But
estandarizada
obviously, that
también ha
standardized
permitido, acá a modo de
information
ejemplo,
has also
algunos de
made
los
it
reportes o
possible
algunos
to
estudios estadísticos que hay publicados
conduct some
en Internet, ustedes
statistical
pueden
studies, and
después
some of them have
revisar.
been published in the
¿Qué
internet,
tiene
and
el
you
software
can check
nuestro
that. What does
adicionalmente a
our
estas versiones?
software
Bueno, tiene
offer
la posibilidad de
additionally in
integrarlo
these
con
versions?
otros
Well, you
sistemas de
can
los ministerios, como
integrate it
decía.
with
Este es un
other
ejemplo de integración con el certificado de
systems of the
nacido vivo en
ministries.
Uruguay.
This is
Hay otros países como
an
Honduras que están recién
integration with
naciendo.
live
Y
birth
después hay algunos
in
países
Uruguay.
que han
Honduras is
empezado a
also using
incorporar
something
el
similar. And there
SIP
are other countries have
dentro
incorporated
de su
SIP
expediente clínico
in
electrónico
their
institucional,
electronic clinical
provincial
record, medical
o
record,
nacional. Que toda esa
either
información no
in
tenga que
the
ser cargada
province
dos
or at a
veces.
national level or
Los sistemas
locally, so
interoperan
that
entre
the
ellos, se
data
envían de
don't
forma fácil
have
de
to
uno a
be
uno,
loaded
tratando
uh,
de mejorar también la
twice.
calidad
The
y
systems
la
send
mejora de la
messages
información.
to each other, trying to
Finalmente,
improve the
les
data. So
comparto
finally,
4
let
breves
me share
pantallas de este aplicativo
4
MISIP. Lo que
brief
están viendo ahí son capturas del teléfono de la
these
mujer,
are
donde muestra
screenshots of
qué sería
the
aproximadamente lo que
woman's
ve. O sea, tiene
telephone,
los
and this is
35 números
about what she
de
sees.
carnet
You have a
perinatal,
summary of the
tiene
perinatal
contenidos para poder
card and the contents.
consultar
that
y
she
donde
can check,
especialmente veo
where she can
o
click,
creemos
and
dentro del equipo que hay una
we
gran oportunidad para la
we
reunión de
see
hoy.
that there's an
¿Por qué?
opportunity for today's
Porque como
meeting
ustedes vieron en la
specifically because,
presentación
as you
anterior,
saw in the previous
este
presentation,
aplicativo MISIP se
this
puede conectar con los
MISIP
servidores nacionales.
app
Al
can
poderlo
connect
conectar con los
with
servidores
the
nacionales,
national servers, and
podríamos
on doing so,
enviarle a la
we
mujer
can
el
send the
resultado de un
woman
examen
the
del que
result of a
sea.
test,
No le vamos a
whatever.
enviar, por ejemplo, un
We
resultado
won't
que diga
send,
usted
for
es de
instance, any
RM
results
positivo,
saying you
pero
are
sí le podríamos
VDRL
enviar un
positive,
mensaje que
but
dijera,
we could
por
send a
favor,
message
comuníquese
saying,
con este número de
please
teléfono, por favor, adelante
call
su
this
consulta. Y es un poco lo que buscamos
phone
con este
number,
aplicativo
or
MISIP pensado,
please
como
come
les
to your
decía,
visit earlier.
estrictamente para la
And this
embarazada.
is what
En
has
esos
been
links que ven
designed
ahí
specifically
hay
for
la
pregnant
demo del
women. In
SIP,
those
para los que no
links
lo
there, you
conocen,
have a
con el
demo.
usuario invitado y
If
la
you don't
configuración
know
del
it,
SIP invitado,
the
o en inglés, con
username
el
is
usuario guest
invitado or
y la
guest in
contraseña.
English,
SIP guest,
and the
pueden
password
conectarse para ver un
SIP
poco todos estos
invitado in
requisitos
Spanish and
cercanos.
SIP guest in
Ahora le
English.
daría paso a Giselle, que nos va a
So
hablar un
now
poco
let me give the
de
floor
los
to
reportes
Giselle,
a
who's going
medida
to
y
talk
quedamos
about
atentos a las
the
posibles
tailored
consultas.
reports, and we are
Adelante, Giselle.
here. We'll be happy to answer any questions. Go ahead, Giselle.
No puedo compartir.
I can't share.
Gracias.
Thank you.
Bueno, como les decía,
Well, as I was telling you,
Luis,
as
y
Luis was
Sandra,
telling
el
you,
EDMI
Luis
exige
and
fortalecer
Sandra,
vigilancia y monitoreo de las embarazadas,
EMTCT requires
entonces, por
strengthening
eso,
both surveillance
estos
and
momentos que
monitoring of the
justamente
pregnant
el
women.
SIP
And that
capta,
is
que
why
es durante
those
el
are the
embarazo,
times that
posparto y el
SIP
recién
gives you
nacido,
information
pueden ser
about
detectados con facilidad a
pregnancy,
través del
delivery,
sistema de información
and
perinatal.
the newborn,
Es
and that can be
entonces un
registered
sistema que,
with the
como Luis
perinatal
les
information system.
comentaba,
As
es
Luis was telling you,
gratuito,
the
seguro
system
y
is free of
privado y por lo
charge, it
tanto
is safe
es ideal
and
para hacer el
private.
seguimiento de estas
So it is
usuarias.
ideal to monitor
¿Se
these
escucha?
clients. Can you hear me?
Hola.
She's asking whether you
Sí,
can
se
hear.
escucha, Giselle.
Yes, yes,
Acá
Giselle, we can
lo que
hear
les
you.
traje fue
What I brought you here is
en una captura de pantalla
this is
de
a
lo que es
screenshot
la historia clínica
of
perinatal para
the
mostrar
perinatal medical
recuadrado
record to
dónde podemos
show
entonces hacer
the
la
box
captación o
where
el
we can
seguimiento
record
de
and
usuarias.
monitor
Acá
the
tenemos
users,
hepatitis B en
the
naranja,
clients. Here we
en
have
rojo
hepatitis B in orange,
resaltado la
in
detección de
red,
estudios de Chagas,
the detection
en
of
verde
Chagas
el
disease,
VIH
in green,
antes y después de
HIV,
las 20
before
semanas.
and after
Destaco que hay
20
algunos
weeks.
países
Let
que,
me
como
highlight
Luis les
that there are some
comentó,
countries that, as
pidieron
Luis pointed out,
específicamente una adaptación
specifically
y en vez de
requested to
tenerlo
adapt
antes
this,
y
and
después de
instead
las
of
20
having it
semanas,
before and
tienen el
after 20
registro por
weeks,
trimestre,
they
primero,
have it
segundo y tercer
per
trimestre de los
trimester,
estudios
first,
de
second,
VIH
and third
solicitados,
trimester. That is for
resultados y
HIV,
el
with
tratamiento,
the results of each
antes y después de
test
las
and
20.
the
Lo mismo
therapy.
para sífilis, que está
And the same
recuadrado en
happens with
violeta.
syphilis. This
Tenemos
is
el diagnóstico
in
y
a
tratamiento
purple
de
box.
la sífilis
We have
con
the
pruebas
diagnosis and the
treponémicas o no
treatment
treponémicas,
with
el
treponemic or
tratamiento de la usuaria y el
non-treponemic tests, and
tratamiento
the
de la
treatment of
pareja
the
antes y
guest
después de las 20
of the
semanas
client
o por
and
trimestre según el
partner,
país.
and either by weeks
Y el tratamiento de la
or
pareja,
by
entonces en este
trimester,
caso
depending
es
on
el
the country,
tratamiento de
and
la
the
usuaria y el
treatment of the
tratamiento de la
partner.
pareja con las
So it's
diferentes opciones. De aquí
the
entonces
user
surge
and her
las
partner. So
posibilidades
with the different
de hacer el
options, and here
análisis.
we see
Acá
the
SIP
different
permite un correcto
possibilities for
seguimiento.
analysis.
Fíjense en
SIP
que
allows you to give
tenemos
a
diferentes
proper
controles con los diferentes datos que se
surveillance,
registran en la historia
monitoring. We
clínica
have
y
all
acá
the
podemos
data that
entonces ir
are
haciendo el
registered in
seguimiento
the
de
medical
estos
record,
usuarios
and
en el
here
caso de
we
que
can
tengan estudios
monitor
positivos.
the course of these
Aquí
clients in the
mostramos
case they
también
have
que
positive
el
tests.
registro
And
de
here we
los
see
datos del
that
parto,
the
si la
recording
usuaria
of
no
the
se
data
controló el
of
embarazo,
delivery,
como a veces
if
sucede,
the
puede
client
entonces con
was
los
not
estudios
controlled
de
during
los test
pregnancy, didn't
rápidos de
go to
sífilis y de
the
VIH,
antenatal visit,
también se pueden
you may
registrar,
have
como
the
está acá en
rapid
verde en
test
la
for
captura,
HIV
ven en verde
and
recuadrado el
syphilis,
estudio,
and
la
in
prueba
green
de
you
sífilis y de
have
VIH, si fue
the
negativa,
diseases of
positiva o
syphilis,
no corresponde.
and
Y el
HIV,
tratamiento
or
contar si o
whether
no
not
no
appropriate,
corresponde.
and the treatment
Y
to put
por
yes or no,
último,
whether
el recién
it's applicable
nacido,
or
el
not. And
correcto
finally, the
registro de las
newborn,
4
the
enfermedades que
proper
nos ocupan en el EDMI
record
Plus
of
para el
the
recién
4
nacido.
diseases
Acá
that
ven
we care about
entonces
in
registros
EMTCT+,
etcétera, y también
recording
los estudios
weight,
de VIH en el recién
length,
nacido,
etc.,
estuvo
and the
expuesto o no,
HIV test
y si
of
recibió
the
tratamiento o
newborn,
no.
whether the
El
child was exposed or
BRL lo
not,
mismo,
treatment or
y el
not, and the
Chagas
same applies to
y la
VDRL,
inmunización, si recibió
Chagas
inmunización de la
disease,
hepatitis B
and
como corresponde al
immunization of hepatitis B.
En ¿qué otras potencialidades
As
tiene el
appropriate.
SIP
What are the
para
potentials can
estos casos?
SIP offer for these
El SIP
cases?
puede
Well,
generar una
SIP
lista de
can
recién
generate
nacidos
a list
que
of
estuvieron
newborns
expuestos y que
that
deban
were
ser
exposed and
remediados
that
hasta los
must be
18 meses después
retested until the age
de
of
nacimiento
18
para
months
justamente
after
certificar
birth,
o descartar la transmisión
precisely to
vertical de
certify or
enfermedades.
to rule
En
out
estos
vertical
casos
transmission
no
of
se
diseases.
cerraría
In
la historia
these
del
cases,
momento
we
del
would
alta
not
neonatal y se genera un
close
anexo de la
the
historia para el
medical record at
seguimiento
the time
del recién nacido.
of
Esto es
discharge,
un
and
ejemplo
you
de
would
lo que
continue to
hizo
monitor
Uruguay,
that
que
newborn. This is an
después la
example of
doctora
what Uruguay
Cabrera
did,
nos
and
va a
Dr.
presentar.
Cabrera will
Pero el
present it
sistema,
later.
fíjense que
But
en
notice
la
that the
guía
system
clínica para la
in the
eliminación de la
clinical guideline
sífilis
for the
congénita y transmisión
elimination
vertical de
of
VIH,
congenital
ya en el
syphilis and
2015
vertical
se
transmission of
proponía
HIV,
y
in
lo authorize el
2015, this
sistema
was already
informático perinatal.
suggested, the SIPA
Otras
was already
potencialidades
being
es, como ustedes
suggested
saben,
and
la
used by
falta
the
de
country. Other
datos
potentials are,
oportuna de los
well, the
resultados de
lack of
laboratorio
timely
demora
data in
obviamente los
laboratory
tratamientos y
results,
puede
of
empeorar
course,
entonces los
delays
resultados. Y una
therapies
solución
and
que
may
buscamos con el
worsen the
SIP
outcomes.
es
And one of the solutions
vincular
that we
el
seek
SIP Plus
with
con el
SIP is
laboratorio, es
to
decir, que sea un
relate SIP Plus
laboratorio
with the lab.
clínico.
So if
Se
the clinical
conecta con el
lab
SIP y manda
gets
los
connected with
resultados en
SIP
forma en
and
línea,
sends
el
the
SIP
results online,
puede, frente a un
then SIP,
estudio, un BRL
when
positivo, por ejemplo,
facing a positive
conectarse
VDRL,
entonces
for instance,
o avisar
SIP
o
may
dar una
connect
alerta
or to
al
send an
personal de la salud
alert
para que
to the
cite al
healthcare
embarazado.
professionals so
Eso
that
fue en
they
primera instancia,
may
pero como
summon
Luis les
the
comentó,
pregnant
también
woman.
tenemos
That is the
entonces
first
la
thing. But
posibilidad de
as
que el
Luis told you,
laboratorio
we also have the
avise
possibility
al
that
SIP
the lab
y el
may
SIP
let
despliegue una
SIP know,
alerta,
and
una
SIP
alarma,
may
y esa
issue
alerta la
an
reciba la
alert, an
mujer
alarm, and
en
the
su
woman
teléfono
may
celular
receive
a
it in
través
her
del
mobile
aplicativo Mi SIP,
through the
pidiendo
MISIP
que
app,
adelante la consulta
asking
por
her
diferentes
to
intereses.
go to her visit earlier because
Entonces,
of something for her
todo esto para
personal
que
interest.
el
What,
SIP,
why do we
además de
do this?
registrar
Well,
los datos
SIP, in
clínicos
addition
y de
to
permitir
recording
el
the clinical
seguimiento
data
de la
and
embarazada y del
enabling
neonato,
the monitoring of the
permite
pregnant
elaborar
woman and the
reportes
newborn, SIP
automáticos
allows you
one click,
to
es decir, que con un
do
solo
one-click
clic yo
automatic
puedo
reports.
obtener
So with
una
a single
cantidad de
click, I
indicadores
can get a
complejos
number
que
of very
requeriría
complex
una elaboración
indicators that would
bastante
require
complicada
quite
de
a
parte de
complicated
epidemiólogos o de
work by
estadísticos. Y ahí, de esta manera,
epidemiologists or
con un solo
statisticians.
clic
So
podríamos
with a
entonces
single
obtener estos
click, we
reportes
could
automáticos.
get this
En el demo,
automated
como Luis
reports.
les decía,
In the
ustedes
demo,
pueden
as
probar el
Luis
demo
was
y
telling you, you can check
corroborar que
it, you can
simplemente
test the
emiten un
demo, and
reporte
you can
yendo
check that
acá
indeed they issue a
arriba
report.
en el
If you
menú
go up here to the
desplegable, se
menu,
selecciona la
this
opción reportes y
you
dentro de
click
esos
on
acá
reports, and
seleccionan
there
en este caso los
and
reportes
here
para
you select,
indicadores
for
del EDMI
instance,
Plus, emiten el
indicators
reporte y
for
obtienen algo similar,
EMTCT
indicadores de EDMI
plus,
Plus,
and
de
it will
impacto
issue the
relacionados con la prevención
reports of
primaria
impact
y
related with
relacionados con el
primary
diagnóstico, el
prevention and
tratamiento y el
related with the
seguimiento de las
diagnosis,
4
therapy, and the
patologías
monitoring
seleccionadas,
of the
como
four
vamos a ver.
conditions selected,
Este
as
es el
we'll see now.
formato que
This
con
is
un
the
solo clic
format
ustedes pueden
that
obtener
you
entonces
can
estos
obtain with a
reportes de
single click.
indicadores
You
que,
can
como les
get
decía,
these
son bastante
reports of
complejos. Por
indicators. As
ejemplo,
I said,
indicadores
they
de
are quite
impacto,
complex. For instance,
casos
impact
reportados de
indicators,
sífilis congénita,
cases
porcentajes de
of
positividad
the
para
congenital
VIH en
syphilis,
embarazadas, en
percentages of
embarazadas
positive tests
jóvenes, en
among the
embarazadas
pregnant women and
adolescentes, porcentaje
younger
de
pregnant women
positividad de
and
esos
teenage
estudios, de esas
pregnant women,
pruebas,
the
para
positive
sífilis, para Chagas, para
tests
hepatitis,
for
etc.
syphilis, for
Estos
Chagas, for
entonces serían los de impacto.
hepatitis,
También
etc.
tenemos
So
indicadores
these
relacionados con
we
la prevención
also have
primaria y salud
indicators
sexual y
related with
reproductiva, es
primary
decir, qué
prevention and
cantidad
sexual and
de
reproductive health.
mujeres, por
That is,
ejemplo,
how many
planificaron
people,
su
for
embarazo,
instance,
cuántas
how many
tuvieron
women
un
planned
fracaso de método
their pregnancy,
anticonceptivo,
and how many of
cuántas de
them did
esas
the
gestantes
did
que no
contraception fail?
planificaron
How many
el
of those
embarazo
pregnant
tuvieron un
women that
fracaso de ese
was
método,
not
el
planning
porcentaje de adolescentes,
pregnancy
de
had
embarazadas en
failed?
adolescencia,
method, percentage of teenagers, percentage of pregnant women that attended to a single visit or at least 4 visits, and finally, early uptake. That is, how many the opportunities, the timeliness for secondary prevention, and the indicators. As I was telling you, we have the diagnosis, treatment, and monitoring of the patients. Here we see indicators including the number of pregnant women that underwent syphilis test, how many of them received the test before week 20, the more timely thing, how many of them how many of the positive tests received therapy, and the partners and their newborns, and the percentage of stillbirth that could be attributed to maternal syphilis. You see that these are quite complex indicators that you can get with one single click. The same for HIV. How many women infected with HIV received antiretrovirals? How many newborns, and the percentage of newborns of mothers with HIV? What were they fed with at discharge? And the same with Chagas disease, and the same with the number of tests, the number of positive tests depending on the age of the woman, broken down by age, and the number of newborns that received tests and had positive results. Hepatitis, some indicators for hepatitis, the number of women immunized and newborns immunized at discharge, and the percentage of pregnant women that had a positive test for hepatitis. So, as you know, SIP is present across Latin America and has been strongly implemented this last year thanks to the assistance of the entire team of SIP in the English British Caribbean, especially Mariana. We want to thank her because of her excellent work with the warmth that she has put to this work. So I leave you here, Rodolfo.
Muchas gracias, Giselle.
I'll stop
Creo que
sharing.
queda bastante claro y ejemplificado cómo un sistema tan versátil y completo
Thank
como el
you,
sistema de información
Giselle. It's
perinatal
very clear
puede
that
ser
this very
utilizado por
complete
el
system,
monitoramiento
such
de la
as the
asistencia de las mujeres,
perinatal SIP,
de los
can
recién
be used
nacidos y de las
for
embarazadas
following
en todo
pregnant women,
todo el curso
newborns,
de vida antes del
throughout the
embarazo,
life
durante el
course,
embarazo,
throughout
incluso en el
pregnancy,
momento del
and
nacimiento,
even
parto y
before
después
and
del
at the
parto,
time of delivery and
incluyendo el recién
postpartum,
nacido.
including
Si
the
hay
newborn.
preguntas, por
If there are any
favor,
questions, please
solicitamos las anoten
write them down
question and answer
in the
y
question and answer
abajo
Q&A
vamos a responder
tab
inmediatamente a las
below,
preguntas.
and we'll answer them immediately.
Antes de pasar a la
Before handing
próxima
the
mesa
floor
panel,
to the next panel,
Giselle, hay una pregunta para ti.
Giselle, there's a question for you. It says,
Pregunta Pilar Portales.
Pilar
Usted ha
Portales
hablado
asks,
del test rápido de
you've
sífilis
mentioned
en
the
Chile,
rapid
por lo
syphilis
menos.
test in
En
Chile,
mi
at
ciudad
least.
no tengo
In my
antecedentes de este
city,
examen.
I
¿Puede usted mencionar
don't have it
al
available.
respecto en qué
Could you tell
países
us
se utiliza
in
y su
what countries
especificidad?
is
Tal
it
vez no es
used
una
and what
pregunta para
specificity
Giselle,
does it
Pilar.
have? Maybe that
Podría
isn't a
ser
question for
más bien una
Giselle, Pilar.
pregunta que
Maybe
puede
for
responder Sandra Jones
Sandra
sobre
Jones
qué países son
about the
los que utilizan
countries
el test
that
rápido.
use
Lo vamos a
the
dejar,
rapid
pido
test.
que nos esperes un poquitito
Please
y le vamos a pedir a Sandra
wait
que
a second, and we'll ask
comentarnos
Sandra
en qué
to
países se utiliza
comment
el test
in
rápido.
what
Esta es
countries
una
the rapid test
propuesta
is
de la
being used.
Organización Mundial
This
de la
is a
Salud
proposal
para
from
acelerar
WHO to
el
accelerate
tratamiento en el lugar
the
de diagnóstico,
treatment in the
test y
place of
tratamiento en el
diagnosis,
mismo
test
lugar.
and treatment in
I
the
don't know,
same
Sandra, if you
place.
want to answer
Do you
right
want
now
to
or
answer right
just
now?
after the panel. What countries are using the rapid test?
Yeah, I don't have off the top of my head all the countries that are using the rapid test, but I can say for in the Caribbean, there are quite a number of countries that are advancing to it. Either they do a test for HIV or syphilis, or they're using the syphilis rapid test separately and the HIV rapid test separately. We encourage Of course, if countries are using the rapid test, if they could use the dual test for pregnant women, so it's only one test that is given to the woman within antenatal care. But of course, these are decisions that the country would have to make based on their health system and what is available. But without having the individual countries that are directly using it, what I would like to just to underscore that most countries are advancing to the use of the rapid test. If not for the entire population of pregnant women, they have developed criteria as to who will be receiving the rapid test as point of care test, not in the lab, but as point of care. Thanks, Rodolfo.
Exacto, exacto. Ese es el punto. Es el
Indeed,
diagnóstico en el
indeed,
punto de
that's the
tratamiento.
issue.
Ese es el
At the
cambio
point
que ha
of
propuesto
care,
la
that's a
región,
change
y
we're
cada vez
seeing
más
in the region,
países
and increasingly more and more countries,
están
Pilar,
utilizando
are
el test
using
rápido en el
the
lugar
rapid
de
test
tratamiento, que es
in the
donde se
point
hace
of
el
care
control prenatal.
where the
Ahora sí, la pregunta
antenatal
de Carolina
visit
Peredo
occurs. There's a
sobre
question from
SIP.
Carolina
Se la
Peredo
transfiero a
regarding
Luis.
SIP, and
Luis,
I'll
si
hand it
pudieras
over to
muy
Luis. Could you
brevemente
please
comentarnos
briefly comment
cuáles son las seguridades
what
que
are
tiene el
the
sistema de información
safeties
en relación
of
a la
the
información que está
information
contenida?
system
Es una
regarding
pregunta
the
de Carolina
information
Peredo.
contained, the
Adelante, Luis.
security? Please, Luis.
El sistema de información nuestro tiene una
Our
cantidad de cosas
information
de
system
seguridad,
has
una cantidad,
many security
inclusive nosotros
items.
le realizamos un poco para tranquilidad de todos los que
And
nos están
for
escuchando.
you to feel
Nosotros les
comfortable,
realizamos test de seguridad
we
periódicamente,
do
le hemos
periodical,
realizado este
regular
año también uno
security tests. We've done
avanzado,
one this
pero
year, an
también
advanced one,
realizan test de
but
seguridad los
the
propios
security tests
países
are also carried out by the
nacionalmente.
countries,
Entre las
and
cosas
this
de
adds
seguridad
on.
que tiene el software
Among the
nuestro,
security items
por
our
supuesto que se
software
entra
has,
con
of
usuario y
course, we
contraseña,
enter with a
tiene
username and password.
la fortaleza de la
It
contraseña
has a strength of
mejorada, se le
improved
pueden
password.
instalar certificados
You
de
can
seguridad,
install
tiene timeout
security
para la
certificates. It
sección,
has
tiene
timeout for
cierre de secciones
sessions.
remotas,
It has a
tiene
closure of
eliminación de
remote
captchas
sessions
para que los
and
robots de búsqueda
captures
no puedan
enabled so
hackear.
that the search robots
Y bueno, y así
can't
una
enter,
cantidad de cosas.
and
La parte de
many more.
seguridad, además, que es
The
más
security part,
importante, lo que
and
están
it's very
consultando,
important.
no se olviden que en la
Don't
mayoría de
forget
los
that
países,
in
más allá
most
de
countries,
toda la
apart
seguridad que tiene el
from
SIP,
all the
está
security
dentro de la
embedded in
seguridad de
SIP,
los
this
ministerios.
is
O sea,
included
que tiene una
within the
capa de seguridad
ministry
adicional
security
que son
system.
las
So it has an
intranet
additional
de los
layer that's an
ministerios de salud
intranet
pública de los
of
países.
the public health
O sea
ministries in the
es un
country
software
itself.
tremendamente
This software
seguro.
is
Capaz que por
extremely
ahí, si hubiera alguna
secure.
otra consulta, luego
If there are
seguimos.
additional
Sería
questions,
eso,
we can
Rodolfo.
continue. That's it,
Magnífico.
basically,
Muchas
Rodolfo.
gracias, como siempre, Luis.
Excellent. Thank you.
Muchísima
As
claridad en la
usual, Luis,
respuesta.
very
Y
clear answer.
Graciela
And
Bernardo,
Graciela
estamos de acuerdo
Bernardo,
contigo
we agree
totalmente.
with
No
you
es una pregunta, es
totally.
un
It
comentario.
isn't a question, it's
Graciela
a
nos
comment.
dice que el
Graciela tells
programa
us
SIP es
that the
excelente.
SIP
La
program is
dificultad
excellent.
está en la calidad de
The
los datos que
difficulty
se
is in the
cargan
quality of
o la
data
falta de datos.
loaded or the
Muchas
lack of
gracias.
data. Thank you.
Eso es tal cual,
That
Graciela,
is exactly
garbage in,
so.
garbage out. Si
Garbage
le ponemos
in,
basura al
garbage
sistema, no
out,
podemos
garbage
pedirle
out.
que
If we
saque
place
diamantes.
garbage in the system,
Por
we
lo
can't
tanto,
ask for
esto sí
diamonds.
tiene
So
que ver con la
this is
calidad del
really
dato que se
related with the
registra
quality
y se
of the
puede
data
obtener mejores datos.
uploaded,
Vamos a mostrar
and we can
en el
improve on
próximo
that.
panel, y ahora
In
te
the
doy la
next
palabra,
panel,
Giselle,
we'll share this
el
and I'll
caso de
hand you the floor,
Paraguay,
Giselle,
cómo
the
ha
Paraguay
incrementado la
case
calidad
and how
del
they've
dato en la medida en que
increased
se ha
the quality of the
implementado
data
el
with the
sistema.
implementation
Adelante,
of the
Giselle.
system. Please,
Quería
Giselle.
comentar en
I
cuanto a
wanted to
eso, es
add
muy
in
cierto
that regard, and that's
que los
true,
clínicos somos
that
difíciles
clinicians
de registrar
have difficulties to
correctamente, pero es
record
importante
things
que se
correctly, but
audite
it's
y el
important to have
auditamiento y
audits
feedback en muchos
and to
países ha
have
tenido
feedback.
mucho
This
éxito.
has been
Es
very
decir,
successful
alguien que
in many
sea
countries. That is,
responsable,
somebody
una
must be
persona, de mirar el
responsible
dato,
for
porque el
looking
SIP
at the
tiene
data
un
because SIP
reporte
has
automático de
an
falta de datos.
automatic
Ustedes
reporting
pueden
system for
desagregarlo
lack of data.
inclusive hasta
You
por
can break it down
profesional,
even
pero
according
lo
to
pueden
professionals,
ver
but
globalmente.
you
Y
can
si hay
look at
datos que
it
están
globally.
faltando,
And if there are
bueno, en
missing
el
data,
seminario o en
well,
una reunión
in
del
the
TAP,
seminar or at a TAP
proponer
meeting, you
mejorar el
can
dato y
propose how
controlar
to
la calidad
improve
del dato
this
es
and
una cosa muy
control
buena para
data
hacer.
quality. That's very good.
Y además,
And additionally,
es muy importante que
it's very
entendamos que
important that
el
we
SIP es una
understand
historia
that SIP
clínica
is
y
a
que
clinical
tiene
record
todas
and
las
that it
implicaciones
has
legales
all the
de no
legal
poner la información adecuada,
consequences
como
if the
cualquier historia
information
clínica.
isn't
En
appropriate,
la historia
as would
clínica lo que
occur
se
with
debe
any clinical
registrar,
record. Then we must
atención,
record
es la ruta
care and that's
atención
the
adecuada
roadmap
para
of
las mujeres
appropriate or
embarazadas
adequate
y recién
care
nacidas.
for pregnant
Con
women and
esto
their newborns.
daríamos
With this,
final a
we
la
close
parte de
the
presentación del SIP. En todo
SIP
caso, si quedan
presentation.
dudas o preguntas, no
If there are
duden
any
ninguno en
doubts or
levantar la
questions,
mano.
please
Vamos
do
a
not
tratar de hacer
hesitate to
lo
raise
más
your hands or write
interactiva que
it
se
down.
pueda
We
esta
want to be
presentación.
interactive
Y
in
vamos a
these
pasar ahora
presentations.
a
And now we'll
una mesa
pass
panel
on to a new
que me
panel
toca coordinar
I will
y
chair,
vamos a compartir algunas
and we're going
experiencias
to
en el
share some
uso
experiences in
del
the
sistema
use
de información
of
perinatal
the
en
perinatal
el
information system
seguimiento
and
o en el
in the
análisis y la
monitoring
evolución
or
de la
analysis
eliminación de
of
la
the course
sífilis
of the
congénita
elimination
en
of
algunos de los
congenital
países de la
syphilis
región.
in some of the countries in the
Para
region.
tener
In
esta
order
mesa,
to
hemos
have this
invitado
table, we
a
have
varios países a compartir la
many
experiencia.
countries
Algunos lo van a
invited to
hacer
share their
de manera
experiences. Some will do
directa
so
y otros lo van a
directly,
hacer
and
con una
others
sesión grabada
with a
y
recorded
otros
session, and
también con
others
video.
with a
Entonces
video.
vamos a tratar de
So
generar este
let's try
espacio
to
de
generate
compartir
this
buenas prácticas para que
space to
vean
share good
cómo
practices
en
so that you
tiempo
realize
real,
how in real
en
time,
países reales, con
in real
dificultades
countries
reales,
with
con
real
profesionales de la
difficulties
salud reales
and
que no
real health
llenan lo que
professionals that
corresponde
don't
en la
fill as
historia
they
clínica,
should
en
the
el SIP o
clinical
doctor,
record, SIP or
cómo
whatever,
esto puede ser
how this
mejorado
can be
para
improved upon
permitir
in
el
order to
análisis de la
enable the
eliminación y
analysis of
permite
the
también la
elimination and
recertificación de
recertification
que estas enfermedades de
at these
transmisión
conditions
materno-infantil han sido eliminadas.
of maternal
Comenzaría
to
con el caso
child
de Antigua y
transmission
Barbuda.
can be
Para
eliminated.
esto
Let's start with
quiero
Antigua and
presentarles al doctor
Barbuda.
Mansur,
So I'm going to
quien nos va
introduce
a hacer
Dr.
una
Mansour,
presentación
who
de la
will share
experiencia de la
the
implementación del sistema
experience in the
informático
implementation of the
perinatal en su
perinatal
país
information system
y
in
cómo
his
esto
country
podría
and how
potencialmente
this could
ayudar y cómo ya lo está
potentially help
ayudando
and
a
is
poder
already
hacer este
helping
tipo de
them
análisis.
to conduct
Dr.
this sort of
Raymond,
analysis. Dr.
welcome,
Raymond,
and the
welcome.
mic is yours. As always, a big pleasure to have you in the meeting. Please go ahead.
Yes, thank you, Rodolfo. Thank you for the invitation to this wonderful meeting, and good morning to everyone who is on Zoom with us now. Allow me a chance to share my screen. Okay. Second for me. Here we go. All right, so I'm hoping that everyone can see the slides.
Yes.
Okay, so thanks again. And so this is Antigua's short history on the strengthening and response to the prevention of HIV and syphilis transmission through SIP+. Our history of our EMTCT committee was long and bumpy, but our goal was never in question. Back in 2016, 2017, our journey towards validation started. And in December of 2017, we received our validation for EMT-CT for both HIV and syphilis. And we have subsequently been revalidated twice. And our next review for validation, I believe, is due either in 25 or 26, hopefully with the possible inclusion of a hepatitis B validation. Our organizational structure for the EMT-CT falls under, of course, the Ministry of Health and under the Maternal, Child, and Adolescent Health Committee, in which the EMT-CT will report to. And it also covers our breastfeeding committee, as well as receive reports from our district nurses, our district pediatricians, and the nutritionists working in the government setting. The EMT-CT committee is comprised of many different parts of our healthcare structure. So there's a chairperson and a coordinator. There's someone from the STI clinic, the maternity sister, the AIDS secretariat nurse, the community pediatrician, district midwife nurse, and the NICU sister. These meetings are usually held once every quarter, and meetings are also called for urgent cases, especially those that are associated with morbidity and mortality. Some key stats about Antigua. Our last estimated population in 2023 was 93,316. Our next census is next year. Our average number of births per year at our only public hospital, the Sir Leicester Bird Medical Center, was about 1,037. And based on our data, every patient has received at least one syphilis test in her pregnancy. These are our rates over the years for HIV, hepatitis, and syphilis. I want to highlight our syphilis row. And unfortunately, Antigua is like many other countries in that we have unfortunately quadrupled our rate of pregnant syphilis patients since 2020. We went from 0.6% to 2.2%. HIV has been pretty steady throughout the years, and Hep B, minus a small bump in 2022, has also been pretty steady. These are stats from the Celesta Bird Medical Center, Antigua's only public hospital. And a lot of this data was generated using SIP plus, SIP data, desktop version, SIP plus, as well as paper. In the statistics shown on the WHO website, Antigua, which is these two small little dots, Antigua and Barbuda, we fall in that 1 to 2.5% category for syphilis. Unfortunately, we do not have any record of Antigua and Barbuda's current HIV rate in the pregnancy listed on the WHO website. The current EMTCT committee collects the infection data using a chart review. The SIP desktop has been used to collect data since 2022. It's been all retrospective. So the future would be to use SIP Plus to incorporate the prospective collection for treatment and monitoring of our syphilis positive and HIV positive patients. The EMTCT board should be able to have access to current positive patients with follow-up of exposed infants. Our partners of HIV and syphilis positive patients are usually referred to our STI clinic for counseling and treatment, and the EMTCT committee tries their best to keep up with the monitoring for these partners. But I'm sure, as everybody knows, it's difficult sometimes with the male part of this partnership. What do we think about SIP Plus? For us, our experience has been very positive. The fact that it's free of cost for most countries who cannot afford a countrywide national database of care, SIP Plus has come as a very cooperative, very informative, user-friendly software. We get 100% support from the team, from PAHO, and from the CLAP Center. I want to mention Mariana, Louise, Giselle. These guys have been, so supportive and helpful in our journey to get to SIP Plus. PAHO has been willing and able to help us with setup and training, and will, I'm sure, 100% continue to do so in the future. And the fact that it's bilingual, I think, has helped me a little bit and helped us all here for the English-speaking Caribbean, because we started SIP back in 2016 using the Spanish version, and that was quite a task to do the translation over for all the different stats. For the EMTCT Plus indicators, our review have shown them to be very detailed. All aspects of the patient and partner have been included. The partner's treatment and surveillance side has also been included. The availability of the SIP to be 24/7 to all those who need to be involved in the care of these patients. I find the ease of input to be stellar. I don't think that there's a very strong learning curve required for EMTCT or SIP Plus in general. I think a very short window, and everyone should be able to understand how to input, as Rodolfo said, good data so we can get good results. And then the already established reports that have been established by the PAHO Center and the CLAP Center have been phenomenal. I think they really cover a lot of what national statistics should look like. And the data range goes from anywhere from global for all your patients down to even if you want to do a monthly review. And that kind of data really helps when we're trying to do, surveillance and monitoring of patients. For us, future steps. First, we want to launch SIP Plus to all healthcare givers. So Mariana, Louise, and Giselle have been very instrumental to getting our desktop version over to SIP Plus. And so having had migration sometime in October, November, we're still kind of working out the little kinks. But we hope to launch to all caregivers SIP Plus in the first quarter of 2025. Secondly, equipment. We have to ensure that the clinics, the public clinics in particular, have access to the internet so that they can access the server. Training, show that there's great benefits to good data, and so that we could make everyone involved in healthcare to our pregnant patients to understand that data is important. You're documenting anyway, just document this data that's reproducible, that is solid, that we could use and generate data on a national side. We have to make sure that for us, at least, Antigua and Barbuda is represented on the world stage from a standpoint of data. There are a lot of charts and listings on the WHO and PAHO website for which Antigua and Barbuda has not been represented yet, and we're hoping to change that soon so that we're represented on that stage. And my last one is I would love to see a regional office for SIP to be established here in Antigua so that we could provide service, assistance, technical, anything that was required to make sure that SIP and SIP Plus is successful. I leave you with a couple of quotations today. Without data, all we have is opinions. And I feel that that's important to recognize. Edward Deming is a US economist who made that comment a few years back. And the second one I want to leave you with is data is the new oil. And I think that tells us all that we need to know. Without data, I think we're gonna be starving for proper structure in our healthcare delivery and monitoring. And so data is our new oil. I thank you everyone for listening.
Thank you very much, Dr. Mansour. You are one of our leaders using SIP in the Caribbean. Congratulations for the advance and the use of the system. We have a question here. Tenemos una pregunta aquí anónima.
We have an anonymous question here that they're asking whether you've thought of incorporating HIV screening in the partner to see the seroconsistency, and the answer is that whether they match. And of course, yes, all the national and international guidelines for screening of the pregnant women all include screening the partners, the sexual partner or partners, because they may match in the positive test. But the importance of the vertical transmission is to focus on the pregnant woman. And of course, when the partner is negative, the sexual partner is negative and the woman is positive, the one that's going to receive treatment to avoid vertical transmission is the pregnant woman. But in the opposite case, routinely screening the pregnant women's partners has not been implemented in all the countries, but there are some positive experiences, including Brazil. The male's prenatal screening, antenatal screening, where the male that goes to the office with the pregnant woman is not just sitting by her side, but is also somebody to care for. So the antenatal care includes the sexual partner, including hypertension, HIV, syphilis, a general screening of vertical transmission infections. So in this case, you could include this systematically in all women, even if they are negative. You can order the screening for male partners, but usually it's not been established as a standard to check in the case of a negative case of the woman, it's not so standardized to screen the male. And there's another question. I don't know whether Luis or Giselle can answer it before going to the next presentation, because it's on what are the difficulties that the countries have had in updating the SIP-based databases in real time to have the data available in real time. What are the challenges that you've had to face? Well, as to the IT challenges, we've seen several, but really, today we have several countries here that have solved that. I won't give you the details of which countries, but and the national consolidation sometimes requires having a server. Although there's no need for a very large server, it has to be in line with a number of records. It's not a country that's Argentina, Uruguay, Nicaragua, where the number of deliveries are very, or childbirths are so different. So that's an issue. Then in the ministries, we haven't seen any problems installing it because our software is quite easy to install. And honestly, we haven't had any issues. Now, what has happened, and this is something that Giselle mentioned and was discussed a bit today, that in order to improve the quality of the data of the records and the registries, having clear standards at the Ministry of Health clearly helps. That's
Luis,
yes, and let me add, Luis, to planning. That is, that the authorities should define and decide that they want to use C++ and to communicate with us so that we can plan it together, depending on the country, because there are countries that are so large. For instance, in Argentina, if they decide to do it, for instance, by provinces and then consolidating it nationally, in other countries like Uruguay that are smaller, it's easier to consolidate it head-on at the ministry. So we can collaborate with the experience that our team has. Our team is not very large, but we are hard workers. So we urge the authorities to contact us so that together we can plan. Depending on the needs, we can coordinate for a national plan for the implementation of SIP, and especially that they should always pick a person to lead the implementation process. Yes, and answering three questions together, Francis Perez, Luis mentioned that there is a way you can access SIP. You can use it as in the demo. Luis is going to include the link again in the chat, giving you access. You can enter and you can use SIP to understand how it works. And the other comment of our colleague from Colombia, she mentions precisely that they are using rapid testing in migratory areas, but with some difficulties to guarantee treatment and difficulties in formulating treatment. Actually, syphilis has a very simple treatment. It's benzathinic penicillin, 1 or 2 injections of benzathinic penicillin until you can certify, as Sandra Jo said at the beginning of this webinar. Positive test is always treated in a pregnant woman. And then you check whether it's an old case or a false positive. You can check with the partner. But positive syphilis is always treated right when you detect it. Diane, responding to your question, whether this can be treated by a nurse. Yes, the answer is yes. Nurses must be a part of the immediate response to such situations. And the other question is by Laura Ana Laura Connery, that say where you can get training on SIP. So Giselle, could you please put a link, because there is a remote course that is in PAHO website, precisely showing you how to use the perinatal SIP, how to cross variables, how to see how it works, and to get trained in the analysis of data. Luis has just put it in the chat, access to the course. So with that, we respond to all the questions, and we move forward with the next country case. That is a recording. Luis? No, as you said about the demo, please do not enter any real data in the demo. It's a demo. It's open to everybody, so be careful about that. Yes, all of those are fictitious cases. It's an open database. So whatever you enter as an exercise, that's okay. Don't do that with real data. So Melina, could you please share the case of Uruguay? Uruguay is a small country, but that has used the SIPA since its inception 30 years ago, and it has modernized its versions first on hard copy, then Windows, and then now Susana Cabrera will present the experience. Well, the goal of this presentation is to show the experience of Uruguay in the use of SIP to supervise the elimination of transmission of HIV and syphilis. Let me tell you that this corresponds to a previous experience when I participated in the HIV program for this monitoring strategy that I'm going to share with you. Defining this plan arises basically from the fact that we found some inconsistencies with the data available. On the one hand, we had the registry. SIP was implemented in Uruguay many, many years ago. It has an excellent coverage. At the time, it was close to 90%. And what it showed us was that there was an increase in the VDRL and reactive in the umbilical cord. So we could estimate that the congenital syphilis would be increasing, while on the other hand, and this is what you see there in the blue curve, the cases that were reported, despite the fact that it's mandatory reporting, were dropping. So there was a clear gap in the data. Furthermore, we had publications and communications at local level from different maternities warning about the increase in the number of congenital syphilis cases. This created concern, on the one hand, because it was necessary to truly know what was occurring and extend this information and assess where we had gaps in the care processes that could be corrected. So, using these tools, surveillance, SIP, and furthermore adding the electronic live birth certificate, that's a national tool, a registry where we record the child's birth. Uruguay has a specificity because nearly 100% of births are institutional, and this entails great coverage. The live birth certificate has a number that is for the ID, and then we included a variable, and that was exposure to HIV. We had these sources of information. It was necessary to deepen further in the situation diagnosis, and to the same, the elimination of vertical transmission of both syphilis and HIV was a goal among the health relevant objectives, and we established a regulation framework to establish a mandatory implementation of case audit for all cases where there was a reactive syphilis or HIV test. This audit during long years occurred on paper. It had to be done by the health effector corresponding to the woman. That was the person responsible. They reviewed all the information provided in the form with social and demographic variables, obstetric history, pregnancy characteristics, time of the tests and treatment, the uptake of the partner, and in turn required an institutional analysis, and the audit would be sent to the Public Health Ministry. And therefore, the audit implementation involved starting with the sources of information, that is SIP and the live birth certificate of any reactive syphilis or HIV test during pregnancy, delivery, and birth, or syphilis in the case of the newborn in the cord blood, completing the audit requested from the institutions and send it to our program. In the programmatic areas, in this case, this topic was elaborated in a comprehensive manner with sexual and reproductive health. The information was obtained, it was consolidated in the database, and this allowed for an analysis. When the audit wasn't done spontaneously, this allowed us in a time not greater than 1 month or a month and a half to request it from the institutions to comply with this goal. So, the implementation of an audit required an identification of records of reactive syphilis or HIV tests in these primary sources of information. We also used reporting the audit data of the woman, and this allowed us to confirm or rule out the record and identify errors in registry. It was approximately 15%, and it allowed us to be aware of information about processes and having a local analysis in the health provider. And in turn, we consolidated the information, we conducted a national analysis, we fed back, we planned and implemented actions. This is gathered in this paper published some time ago, and in the graph at left, you see the audit that was started in 2013 and its impact on the rates of congenital syphilis, particularly at the national level, and where we had more issues, and that was in the capital area, in the metropolitan area with HIV. There was a significant fall in transmission that allows Uruguay to have figures corresponding to elimination since 2015. And furthermore, identifying, as we said, the factors that could contribute towards these poor outcomes, the ones described: few prenatal visits, the delay in the syphilis diagnosis and treatment of the partner. And identifying these factors also allowed us to locate where the issue was, to say it somehow. For example, in relation to the diagnostic delay, we realized, although we thought it was the opposite, there was little access to fast tests in the point of care. And this allowed an improvement of planning of input and its distribution and training of human resources for all the members of the health team in the point of care. We could have a rapid test to a woman who attended to control to monitor her pregnancy. It also allowed us something we didn't have, and it was access to benzodiazepine penicillin in the first level of care. The woman was diagnosed and referred to a second level center for treatment. So some were lost there. So we identified where we had the gaps, and this allowed us to plan and implement corrective actions. With HIV, the situation is clearly better. Here we have the results of the 4-year assessment, and essentially you can see the fall in the rate of vertical transmission. This clearly is directly related with the increased diagnosis of HIV, knowing the women who during pregnancy have a prior diagnosis, and it's nearly 50% or more in Uruguay at present, surely. Early diagnosis during pregnancy, antiretroviral treatment, and undetectable viral load. So when improving these indicators, there's a correlation also with a fall in the vertical transmission rate, and we could identify the variables linked with vertical transmission. And the ones we have here in the chart are variables that can be obtained via SIP. This is a list of indicators you can all obtain in SIP, with an advantage that the availability of SIP Web allows this to be done in real time, and we don't need to do what we did before. That required a consolidation to access these indicators, and this entailed a delay. So SIP is clearly a very useful information tool that allows us to take action to improve the reliability of data and know the indicators, particularly those with impact and process. So as a summary, I want to tell you that knowing the magnitude of the problem is essential. As a basis, we have to have good knowledge and, if possible, of national scope to investigate the factors contributing to the persistence of the problem, in this case, congenital syphilis or perinatal HIV, evaluation of processes and outcomes, planning actions, having the necessary resources, implementing measures, and doing monitoring and assessing the outcomes, having sufficiently sensitive and accessible data with broad coverage is, of course, mandatory. It's basis for us to design strategies, measuring them so that they are representative and reliable. And this will enable us to be knowledgeable about the reality and reach the goal we all want to of elimination of HIV and syphilis transmission in children.
Bueno,
Good.
muchísimas gracias
Thank you
a
so
la
much.
doctora Cabrera, quien ha
Dr.
compartido con
Cabrera,
nosotros
who has shared with
la
us
experiencia del
the
país
experience, the
en
country
el chat.
experience
Hemos compartido
in the
también la
chat. We
publicación a la
also
que
have
ella hace mención, donde se
listed the
describe
publication
el
she
sistema de
mentioned
auditoría
describing the
de
audit
cada caso,
system
y como ella
for
lo
each
menciona con
case.
mucha
And
claridad,
as she
esta
clearly
alianza hizo
said,
misiones hace un tiempo de
they have
poder
been able
reclamar
to
la eliminación del
request
VIH de
the
transmisión
elimination
vertical,
of
pero como
vertical
están
transmission of
vinculadas
HIV
las dos
because
enfermedades para hacer
both
certificación
conditions are
conjuntamente,
related
tanto
to have a
sífilis
joint
como
certification,
HIV,
both
todavía
syphilis and
le queda un
HIV.
camino por recorrer
There is
en el
much
sector
to be done
público,
in
dado que el
syphilis
sector
in the
privado
public sector
ya
because
habría
in the
realizado
private
esta
sector
posición.
they
Así
have
que
reached this goal
muchas
already.
gracias
So
al
thank you,
país, a Uruguay, por no solo ser
Uruguay,
sede del CLAP durante
for being
estos más
the
de
CAP
50 años, sino
headquarters
también
during
por
over than
utilizar el
50 years,
sistema y mostrar cómo
but
el
for using the
sistema
system
ha
and
sido
showing how
eficaz en el
it has
mantenimiento
been
y en el
effective
análisis de
to
las
maintain
afectaciones.
and
Me
analyze
gustaría,
congenital
Melina, si
syphilis.
pudiéramos
Now,
compartir
Melina,
el video
could
de
we please share
Argentina,
the
el
Argentina
doctor
video?
Bolsán
Dr.
va a compartir
Bolsan
con
will
nosotros un
share
poco la
with us
experiencia
their
del país, de
experience, the country
Argentina, en el
experience in
uso del CIP
Argentina
Plus
when using SIP
para
Plus
evaluar el
to
área de salud
assess
materna,
the
perinatal,
maternal, and
y nos va a contar
perinatal
un poco
health
de la
area and tell
implementación,
us about
cómo
the
se ha hecho a
implementation
nivel de los
and how
estados
it's
o
been
provincias
done
en
at
Argentina,
province level
y
in
cómo
Argentina and
se ha pasado del SIP
how they
web
pass from SIP
del
web
SIP window, perdón, al SIP
to,
web, al SIP
he corrects himself,
Plus.
from SIP
Así que
window to
Meli,
SIP
si pudieras
Plus. So
compartirnos
Meli,
el video, por
could you
favor,
please
de
share the
Argentina.
video
Muchas gracias.
from Argentina with us, please? Thank you.
El sistema informático perinatal en
The
Argentina
perinatal
tiene una
information
larga
system in
historia, una larga
Argentina has a
data de
long
3 décadas por lo
history
menos.
of 3
Hoy tenemos
decades
a las
at least.
24
At
provincias
present, we have
argentinas,
the
así como se
24
denominan
Argentine
los
provinces,
distritos en el
that's the
país,
name of the districts
utilizando
in
el
the
SIP,
country,
y en
using
estos
SIP,
momentos el SIP
and
está
at
siendo utilizado
present,
como
SIP
fuente de
is being
información
used as
no
a
solo
source
para
of
el Ministerio de Salud de
information
la Nación, sino
for
para los
the
ministerios de
public
salud
health
provinciales,
ministry and
para los
at
propios sectores
national
salud
level and at
hospitales
provincial level
y,
and for
digamos, para
hospitals,
la elaboración de políticas
and
públicas a
to
nivel
assess
nacional y
public
provincial.
policies at
Entre las
national and provincial level. Among the national ones, I will tell you about all-encompassing law of the first 1,000 days caring for pregnancy, supported on SIP, among others. That is, the indicators of course and evolution used by SIP. And additionally, we're using with SIP Plus today as an added value, overcoming what the system has been to date, and included among the strategic priorities of the Ministry of Health in the country.
Bueno, muchísimas gracias.
Thank you so much, Dr. Warsan, for sharing this experience with us. If possible, Melina, now would like to hear the experience in Trinidad Tobago, another Caribbean country that has implemented the perinatal information system with a rather different orientation, but that shows us anyhow how a Caribbean country, apart from Antigua and Barbuda, we have heard of by Dr. Mansour, how Trinidad and Tobago has used SIP. Please, Meli, could you share the video?
We are adding on connectivity with the laboratories in Trinidad and Tobago as part of another pilot project with respect to getting laboratory results into the patient records in the electronic format, so no longer would the clinician have to access multiple different computer interfaces. They will all be seamlessly populated into the SIP record as part of this project and improve the functions of the clinicians. We have recently formulated a new module related to intimate partner violence, which will be piloted for the first time, which allows a healthcare provider to document any issues related to violence in a structured format in an electronic form. This speaks to the versatility of the perinatal information system, and it can form part of an entire clinical record system.
Muchísimas gracias. Y así tenemos un pantallazo general.
That gave us a general overview of countries both of the Caribbean and Latin America that have used the perinatal information system for implementing the EMTCT plus. So now let me share in the name of Dr. Patricia Ovelar this presentation. Unfortunately, Dr. Abelar had a health issue, but we are going to try to present her data. And I'm going to talk about another experience of Paraguay. So we know that based on data published by the Ministry of Health itself, they have the positive serology percentage for syphilis among pregnant women is around 30%, from 2 to 3%, with an increasing number of pregnancies. In the first record was 98,000, now it's 115,000. In addition, the women that go to antenatal care during this period of time and had positive serology, how many of them received proper therapy? And notice that it's quite low. There are big difficulties to access therapy. Half the pregnant women receive the adequate treatment that is simply benzathinic penicillin. So if we look at the rest of the indicators of the Ministries of Health that were published in 2022, we see that the percentage of congenital syphilis registered from 2019 to 2022 is about 0.4, 0.5%, and while childbirth increases. So if we take this as an example, in a seminar similar to this one, A couple of years ago, Dr. Patricia Velar, that at the time was in the Department for the Care of HIV in Paraguay, shared this with us. The methodology of the analysis was to conduct an observational retrospective study, cross-section study nationwide of the data available in SIP Plus from 2018 to 2021. It was then that they started implementing SIP Plus and starting scaling up into more and more centers. The idea is to be able to do real-time assessment of the indicators. Among the most important results, there's a significant loss of data because people are not filling the data. It's not that the system lost the data, but it never entered the data. So the entering the data continues to be poor quality, and when in the case of EMTCT, the quality of data is reduced. The incidence of congenital syphilis is very high, much higher than expected. And in the variables analyzed using a statistical analysis, they determined that a significant risk factor was adolescence. The adolescent girls were at a much higher also for having it. So they decided that it was very important to define the quality of the registration, and the professionals needed to receive training into how to fill in the SIP so as to improve the performance and to reinforce sentinel centers and integrating the SIP Plus with the National System for Surveillance, Pronacida, for surveillance of syphilis. And here I'm quoting the doctor Ovelar, who was telling us, this is what she said when closing this lecture. Melina, are you sharing the audio?
No, no se escucha.
No,
Rodolfo.
we can't hear it, Rodolfo.
Lo que podemos hacer, si quieres probar,
What
es
we
dejar
can
de
do,
compartir
if you wish,
cuando vuelves a
is
compartir,
quit
te tiene que
sharing,
dar
and
la
when you
opción
share
de,
again, it should give you
compartir audio.
the choice to share audio.
Share. ¿Se escucha?
Can you hear?
No, aún no lo
No,
escuchamos.
not yet. Well,
Vamos a seguir, no hay problema.
well, let's
Acá
go
es
on.
son
That's
breves
okay.
palabras de la doctora
These are
Ovelar,
brief
donde nos
words
dice
by
lo
Dr.
mismo, pero
Velar,
con
where she
versiones
tells us
hechas,
just as
pero dicho
what she
por ella y
concluded with the
sus propias
paper,
palabras.
but in her own
De todas
words.
maneras va a quedar y está grabado,
Anyway, it is
la
recorded,
presentación. Así
and
que
you have it
los invito
available
a
in the
escucharlo
presentation.
con
So I invite you to
atención.
listen to
Muy
it
breve,
with great
frase donde ella nos cuenta
warmth. It's a
justamente
brief
lo que
sentence
descubrimos
where she tells
haciendo este
us
estudio.
what they
Acá
discovered
tienen
when conducting
la
this
carátula
study.
del estudio,
Here
fue
you
publicado a
have
principios de
the
este
cover
año,
of the
pero en realidad
study that
fue
was
hecho un año y
published
medio
early
antes,
this year, but
donde
actually it
trabajamos
had been
con las
completed a year and a
autoridades del
half
Ministerio de
earlier,
Salud
where we
y
worked
también
with the
de la
authorities of the
OPS
Ministry of
y
Health
de la
and
Universidad
PAHO and the
Paraguay. Por
University
lo
of
tanto,
Paraguay.
son las autoridades
So
nacionales las que
it's
evaluaron
the
su propia
national
performance
authorities
y
that
vieron
evaluated
dónde
their own
estaban los
performance,
problemas
and
más,
they detected where they
más
were
crudos
facing
en la
the worst
realización
problems
de este estudio.
in conducting this
Se
study.
juntaron en estos años
So
32.000
these
historias
years, they put
clínicas. Estaban
together
cargadas ya de
32,000 medical
sistema
records that had only been
desde el
loaded in the
2018 hasta el
perinatal
2021.
system,
En ese
and
periodo
from
de tiempo,
2018 to
la muestra
2021.
representaba
In that period, the
inicialmente
sample
1%
initially
de los
represented
nacimientos y
1.5% of
al final
births,
del 2021
and
representaba
at
el
the end of
3% de los nacimientos.
2021, to 2021, 23% of births. So this shows how it was implemented in the different centers, and the database increased in time as the centers joined. We saw that most of the loss of data occurred in 2020. This coincided with the start of the pandemic. Here we have the greatest loss of data, the percentage of women, pregnant women with over 4 visits. And there they describe the 506 cases they identified with congenital syphilis, which would give a rate of 10 per 1,000 live births. So although it is not a nationwide sample, it's a sample of several hospitals where 33% of the babies are born, there would be a much more significant increase of congenital syphilis that they suspected. As to the indicators, notice that these are primary, these are related to diagnosis and impact, access, and primary and secondary prevention. And precisely the source of all these indicators is perfectly feasible to take them from the SIP+. All the data is available at SIP+. So here you have how the sample increased in 2018 with 1 or 2 maternities, 1.5%, and in 2021, the sample corresponded to 23%. So there's an increase, as we saw earlier, in the data entered. And we can use a univariate analysis to analyze which variables or what determinants are the determinants at higher risk in more than 500 cases of congenital syphilis. And notice here that adolescent pregnant women had a significantly higher incidence, 1.8 relative risk of congenital syphilis as compared to the adults in 2019. And this risk shifted and they were equal to the adult population. So there is a transition of data, and this analysis is possible precisely thanks to SIP+. So what are the conclusions? With existing data, we know that there is an under-registration of the case of gestational syphilis that is to be expected initially, but then it improves. As Dr. Tomaso said, we have an indicator that measures the lack of data in each of the variables in the system. And what is proposed here is to coordinate with Cipronacida, where they have they record HIV/AIDS and the vertical transmission. And what did the doctor of Trinidad and Tobago showed us? The interoperability that was obtained with a centralized lab in Trinidad and Tobago could be exactly the same path that could be followed in Paraguay. So with this, we put an end to the cases we shared, and we start to try to respond to some of the questions that are unanswered. So there's a question on Colombia, the implementation of the perinate of SIP in Colombia. I don't know whether Luis or Giselle want to answer.
Sí, en Colombia se hizo
in Colombia
algunas visitas
several years ago, and we worked for the implementation of SIP, specifically in Bogota. It's a bit difficult in Colombia, but you can communicate with us and we can do the follow-up. It's a bit difficult to respond just at this meeting. Perfect. Thank you, Luis. Giselle, Dr. Mansour.
To have one addition, this is the time, and we are going to the end. Vamos llegando al final del webinar. Agradecemos la
We're
permanencia
approaching the end of the
cada
webinar.
uno y
We
cada una de
thank
ustedes.
each and
Si
all of
no
you
hay
for
ninguna
staying.
otra
If there are no more
pregunta o duda o
questions
comentario,
or doubts or comments,
vamos a darle paso entonces a
so
Sandra
now
Jones,
let's
que
give the
nos
floor
va a
to
contar
Sandra
un
Jones,
poco sobre
who's
la
going to
experiencia
tell
que
us a bit
tiene
about
la Organización
their
Panamericana de la
experience
Salud en la
at
implementación
PAHO,
de un curso a distancia
implementing a
que
remote
será
course
implementado para
that was
resolver
implemented,
algunos
an
puntos
online
de
course
bloqueo
that was implemented
específicos
to solve some specific
identificados
bottlenecks
en la
that they
eliminación
identified
de la
in
sífilis comunitaria.
the elimination of congenital
Sandra,
syphilis.
please,
Sandra,
the
please.
floor is yours.
Yes, thank you very much. Can you tell me if you're seeing my screen?
No, you are not doing that yet.
It says. Okay. Is it good?
Starts. Yes. Now you are sharing, put that in the presentation mode, and you are ready to go.
Perfect. Good? Yes. So I would just,
Perfect.
in order, just briefly to say that in order to understand, to respond to requests from member states and the need to strengthen the screening and the timely diagnosis of treatment for syphilis, especially within the pregnant woman to move towards elimination. PAHO supported the development of an e-learning course, which was developed in collaboration with the Ministry of Health of Jamaica. And this is to actually support, as I said, the EMTCT. The course addresses some of the key issues noted with the clinical management of pregnant women and the exposed infants. And of course, yes, it does include the testing and the treatment of the partners. It has 3 modules, and each of the modules are about 30 to 40 minutes, with a total of 12 hours needed to actually complete the course. The course basically focuses on 3 modules, as I said. Well, it has an introduction. It has the first module give an overall overview of syphilis. The second module talks about congenital syphilis, and of course, it uses the surveillance definition for syphilis, also the clinical aspects. And of course, the third module deals with partners and penicillin desensitization in pregnant women with penicillin allergy. For my apology for the typo. We have seen in lots of countries where penicillin allergy has been noted to be a problem, and as a result, women are treated with other medication beyond penicillin, and that is identified as a congenital syphilis case. The course also includes different scenarios. Here I refer to them as case studies. There are 3, and which at the end of the course, you will be able to get a certificate. The target audience is basically for healthcare providers from different health facilities, clinic, hospital, maternal and child health, antenatal care hospitals, labor and department, professionals and volunteers from NGO and community-based organizations, everyone who wants to have a better understanding of the screening methods available, the treatment, and how to avoid the mother-to-child transmission of syphilis. Following the completion of the course, which there is a test which in the individual must have a minimum of 70% of the correct answers. And once that is completed, there is a certificate that is issued at the end. This course is available on the PAHO virtual campus for everyone who would like to really take this course. It's open in English and Spanish. Rodolfo, you could advise if it's there in Portuguese as well. I can't recall. This course is available, and the link is there for those who would like to access the course. It is for those in the Caribbean. It is also on the Caribbean node of the virtual learning campus. And that's my end in terms of reintroducing the course and to inform others as one of the additional tools that is there provided by PAHO to ensure that together we are moving towards the elimination of the mother-to-child transmission of syphilis, but also, as I said, within the wider context of the elimination agenda, because syphilis is very key. So by utilizing that course as well, it will also serve to address the concerns and some of the issues with syphilis in general for the general population. Thank you very much, and over to you.
Thank you, Sandra. The answer is este curso de capacitación está en español.
Answer is this training course is available both in Spanish, English, and French. We're thinking about
It is
Haiti.
in French, English, and Spanish. We have evaluated more than 15,000 people already taking the course. And it is really, a very nice group of providers y tiene la posibilidad de enfocarse
And it
sobre
has
los
the
puntos
possibility of
críticos,
focusing on
cuello
critical
de botella
issues,
que hemos
bottlenecks
identificado que impiden
identified
el
that
avanzar en
prevent
la eliminación.
advancing
Entonces,
in
muy bien,
elimination.
Sandra,
So, as
está
Sandra well
disponible,
explained,
es
it's
gratuito y
available,
pueden
it's free of
entrar
charge,
en
and you may
las plataformas
find the
virtuales
link
del campus
in the
de la
campus
Organización
virtual
Panamericana de la Salud
platform of
para
PAHO
poder tomar el
to
curso y una vez que
take the
pase,
course. And
es muy
after,
especial este curso
well,
porque
it's a
tiene
very
además
special course
campos
because
simulados
it
clínicos.
also has
Si ustedes hacen un
simulated
tratamiento, se hacen un
clinical
test,
fields.
la
If you
simulación
conduct a
que
treatment
sigue
and a
después
test,
cambia.
the simulation
Ustedes
of what
le
follows
indican el
changes.
tratamiento precoz
If
a
you
un niño,
prescribe
tienen
early
la
treatment,
posibilidad
well, you
de
have
tener
this
desenlaces
possibility
malos
of having poor
con
outcomes
un niño que nace con sífilis congénita
in a
o
child born
desenlaces
with
muy
congenital
buenos de una
syphilis,
mujer que
or
puede ser
good
operada
outcomes
para
in a
el
woman that
embarazo
can be
y el
cured
niño
during
nace sano.
pregnancy
Todo
with a
esto tiene
healthy
un
child.
algoritmo de opciones
This
que
has an
enseña
algorithm
las
of
propias
options that
decisiones
will be
que
guided
ustedes
by the
tomen. Es
decisions
un
you
curso
take.
didácticamente
It's
muy
a
innovador y
very
muy divertido
innovative
para tomar.
course, and it's
Cuando
very
aprueben el
amusing
test
to take it.
final, el
When you
certificado
pass
se
the
emite
last test,
automáticamente
you'll have an
firmado
automatic
por el director
certificate
de la
signed
Organización
by
Panamericana de la Salud.
the
Así
director of
que esto
PAHO.
también es
So
un incentivo interesante.
this is an
Bueno,
interesting
con esto
incentive. Well, having
terminamos de
said this,
compartir
we have
los
shared
elementos técnicos,
all the
los
technical
elementos de
parts
implementación
for
y las experiencias de
implementation
los países
and
y
positive
vamos a
experiences
dejar
in
a
countries. So we'll
Sandra
now
Jones, quien nos
hand the floor to
hará
Sandra
el
Jones,
cierre
who will
en nombre
give the
de
closing
Mónica
words on
Alonso,
behalf of
la
Monica
directora del área.
Alonso,
Así que, por
the area
favor,
director. So
Sandra,
please, Sandra, the
el
floor
closing
is
comments.
yours.
Yes,
Pido a
thank
todo
you
el
very
equipo
much,
que enciendan sus cámaras.
Rodolfo. Yes, can you hear me?
Yes.
Yes. So thank you very much. And as Rodolfo said, on behalf of Dr. Monica Alonso, the unit chief for HIV, STI, and TB at PAHO headquarters, I take this opportunity to thank you for participating in the webinar. Thanks to CLAP for organizing the session and to all those who participated in the agenda. At PAHO, we value the strong partnership and coordination with member states to advance the health of the peoples of the Americas. I want to say special thanks to the countries that shared their experience on this platform, as well as through video, their experience with utilizing SIP and how it has supported and how they plan to use the SIP to support the EMTCT strategy in the future. I am sure that you will agree with me that this was a very informative session, which I know will bear many fruits, especially to the countries on the path to attaining validation and those that are being revalidated for the EMTCT of HIV and syphilis. And we hope that with the use of SIP, that we will have more countries coming forward, will start to come forward, that countries will start to come forward, I should say, for hepatitis B, the elimination of the mother-to-child transmission of hepatitis B. I am excited and I'm pleased that this morning we addressed the use of SIP and the manner in which it can support surveillance for EMTCT+, as well as the information critical to demonstrate the achievement of the targets which are included in this SIP. I want to say thanks to CLAP for the hard work and dedication in strengthening the perinatal system that can respond to the multiple needs of the member states. As I highlighted and demonstrated earlier in the presentation, it is essential for countries to have an adequate surveillance system that will capture and also monitor the cases for triple elimination of the mother-to-child transmission of HIV, syphilis, and hepatitis B. But it is not about just collecting the data for reporting, as we all know, and to demonstrate every 4 years to WHO that you have maintained the certification status, but the ability to have timely and reliable data, which will allow to identify very quickly the cases and ensure appropriate interventions based on the national protocol. That is extremely important. I am sure you will agree with me that the regular review, analysis, and utilization of the data will help to support the programmatic gaps and will support the improvement of the services to ensure quality and timely services to women and children. So I thank you for participating in today's session. In closing of this webinar, I want to remind that EMTCT certification from WHO is the achievement of a work well done at the country level. And we know and we congratulate all the healthcare providers that have worked tirelessly to ensure that services are provided, quality services are provided for women and children within the framework of maternal and child health. I take this opportunity to say that PAHO is committed to working with countries to advance the elimination agenda. And I also take this opportunity to pledge our continuous support to member states in doing so. For those countries in the Caribbean, we really do look forward to working with you closely through the regional project to strengthen maternal and child health to respond to the EMTCT, of which I mentioned earlier, surveillance is a big component of it. And we hope that we will be able to work with you to actually strengthen the surveillance in your countries. Once again, thank you very much for participating in this webinar. It was, as I said, very informative, and I hope that you have a wonderful day. Thank you very much, and I turn over to you, Rodolfo.
Thank you, Sandra, and I will ask you, all the participants, if you can open your camera just to have a group picture. Les pido a todos si pueden encender sus cámaras. Así de ese modo tenemos
turn on your camera so we have a picture of the participants in our webinar. Please turn on your cameras, and Melina will tell us when we have the pictures for everybody in the group. So thank you for your interest and participation. Thank you all to the interpreters also who have worked tirelessly. Thank you all. Tell us when you're going to take the picture. That's it. Good. Thank you. The recording of this webinar will be available as usual, both in English and Spanish.
And the same for the Spanish part. Thank you and have a nice day. Bye-bye. Bye, Sandra.
Gracias.
Bye.
Bye.